Hello, everybody. Welcome to this live session. I'm Dr. Andrea Furlan, and it's my pleasure to talk to you again. Today is a Wednesday. It's a time a little bit different. I try to do my lives on Wednesdays in the morning, 11 o'clock, but today I had to give a talk at a conference. I had to go to another city here in Ontario to give a talk to a group of family doctors, so I couldn't be here at 11 o'clock. I hope you didn't miss me that much, but I'm here today, and I hope to hold this live sessions every Wednesday if possible. I hope you enjoyed if you watched the live session last Friday. I was doing the whole day Friday last week. I still have to edit that video. It's about 7 hours long, that live. It was during the Canadian Pain Society annual scientific meeting. So I have to edit because they use a lot of songs that are copyrighted and music in that video, in that presentation. And I need to go and remove every one of those songs. So every time that I remove a piece of song, it takes a long time for YouTube to edit for me. So that's why it's taking so long. I hope you enjoyed that event. I did. I learned so much last Friday at the Canadian Pain Society. And then I stayed for the conference Saturday and Sunday, and I learned a lot. And because I was taking notes and learning so much during the conference, I have lots of new knowledge to bring to you in this channel. So get ready. I need to record a lot of other videos, and there are so many interesting things in the field of pain, pain science, pain education, people with lived experience who are doing amazing things. So stay connected here. Don't forget to subscribe to my channel and turn on that little notification bell so you can be alerted when I join here. And I see here Miss Cheryl Belland from Sarnia, Ontario. Yes, she attended the conference. Yes, the conference was epic. I agree with you. And I interviewed Cheryl, and I'm going to edit that video. And hopefully, Cheryl, our video that you gave an interview to my channel will be posted soon. I hope we will be able to post very soon. Rosângela is here, de novo aqui. Yes, Rosângela, welcome back here to my channel. I'm delighted that you guys are here. What I'd like to talk today is about an experience that I had with one of my patients recently. This is an experience that is very common with many of the patients that I see with chronic pain, that they feel trapped by the pain. They feel that they are in a roundabout. You know what is a roundabout? I don't think we have roundabouts in Canada, do we? If you know of a roundabout in Canada, let me know. But when you go to Europe and other countries, we see a lot of roundabouts. So this is a roundabout. You know, that you drive through, let's say you drive here, and then you have to go all around, and then you have to choose which exit to take, and then you exit there or exit here. So this is my new book, You Are Unique and So Is Your Pain, and exercise on page 5 is about a roundabout. And this is what we're talking today. It's about feeling trapped, not getting out of the roundabout. And I'm going to help you today. If you are in that situation, stay to the end. If you're not in that situation, but maybe you know someone who is like that, maybe you can help someone, okay? So I hope you will get unstuck if you are in that roundabout, because it's a horrible feeling. I have, as I said to you, I had a patient recently, and she is in that stuck, she is in that dark place, okay? So remember that this video is not intended to provide you with medical advice. This is just for education, to enlighten you. This is just to open your mind for what may be happening. This is just to maybe open a door for you to find an exit that you can get out of this roundabout. Maybe this will show something about your thoughts, your emotions, your feelings that you did not even know that you were having. because being in that space and being in that place is very stressful. And for us, like when when I see a patient like that, I'm the physician, and then what can I tell the patient to help them? So I'll tell you what is my approach, okay? So I'd love that you introduce yourself if you're here today. So Cheryl already introduced herself, Rosangela, Maureen from East, is that Tennessee? And we have Kelster 13. Hi, Kelster. Yes, so multiple sclerosis. Yeah, so that's very good. Thank you for introducing yourselves in the chat. I love to see where people are watching from, because I know there are people from all over the world. Okay, so, and if there is any emergency while you're watching this video, please disconnect YouTube, turn off, and go to the nearest emergency department or call an ambulance, because we don't have the ability to help you if there's any emergency, okay? And I see here also checked at the door. Hello, you are Kristen from Oklahoma. Wow. And Lucy is here as well. Welcome. Welcome to this live session. Okay. So let's first talk about the topic today is about feeling trapped by pain. What does it mean? What do we mean by this? This means that maybe the person has a chronic pain condition and they are having pain and the pain is not getting better, and they're trying multiple treatments. Maybe they're doing everything that the doctors, the therapists told them to do. They're taking the medicines. Maybe they are doing all the physiotherapists, the exercises. They're doing their meditations. They're trying hard to get better. But instead of the pain getting less intense and less frequent, the pain seems to be stuck. The pain seems to be stubborn and it's not going away, and it's probably getting worse. And it may be also spreading to other parts of their body. And they are seeing multiple specialists. I get patients that come to me, they have seen neurologists, rheumatologists, surgeons, orthopedic surgeons. They have seen anesthetists that did injections. They have seen other physiatrists. I'm a physiatrist. Maybe they saw multiple physiatrists. And then they took all the medications. They tried drug and they tried this and tried injections. And instead, the pain is not going away. As I mentioned, the pain may be becoming more frequent, more constant, or maybe it's spreading through their body, or maybe it is getting worse, more intense. So this is what I mean, trapped by pain. And this creates a lot of emotions and thoughts inside of their heads because they doubt the healthcare system now. And they become suspicious that what's wrong? Do I have some rare, weird disease that nobody knows about? Am I the only one in the world that have this, and maybe my doctor never heard about this, so they don't know how to diagnose me, right? So this is what I mean when I say getting stuck in the pain cycle, getting into that roundabout, okay? Maybe you know someone who is like that, or maybe you are in that situation like that, or maybe you were in the situation like that. So this is what we are going to talk here. Yeah, Ruth. Hi, Ruth. Yeah, Ruth is saying pain doctors don't help treating, not like humans sometimes. Yeah, treating you like a junkie. Wow, that makes even worse, right? I agree. And Lucy is saying, can you please tell me what treatment should be taken for urinary tract infection? Yes, so sorry, Lucy, I can't give you a recipe here. I'm not here to treat any person in particular. Please talk to your doctor about a urinary tract infection. Yeah, so some people take a lot of pills every day, like they take painkillers, they take antidepressants, they take anti-epileptic drugs that are all prescribed to treat pain. And instead, their pain is not getting better. They're getting injections. They're getting a lot of diagnostic tests, more blood tests, and more imaging tests. And it seems that nothing is getting better. So let me tell you one thing. This situation is very common. It's not rare. Okay. It may seem rare to you, because if this happened to you, you are the only person that you know had this. But we in the pain clinic and in the medical system, even physicians who work in emergencies, we see this a lot. We see this a lot. So it's not a rare condition. It's not that you probably have an obscure diagnosis that nobody knows what it is. We'll talk about that, okay? But let me tell you, this is very common, very common. Every day that I have a pain clinic and I go to the clinic, I see not only one, but multiple patients like this, okay? So think about that. Okay, so let's talk a little bit about what could be the explanations. Before I give you some solutions how to get unstuck, let me tell you what could be the explanations why this is all happening, okay? So one explanation makes sense is maybe the doctor is really missing a diagnosis. Maybe the doctor doesn't know what you have, and maybe it's missing, and you are worried that the doctor could be missing a thing like a cancer that is spreading through my body, or maybe I have multiple sclerosis and the doctor doesn't know. I have a neurological condition, or maybe I have an infection, a virus or a bacteria that entered my body and now it's spreading all over. Or maybe I have a genetic disorder that is affecting my bones, my collagen, my muscles. So those things go inside of your mind. I know pretty sure that those things go inside of your mind. Everybody go. We are humans, so we want to have a diagnosis, right? So let me tell you one thing. It's really important that you be open with your doctors, those who examined you, and say, and ask them, what kind of diseases are you looking for? Did you exclude some of these things? Do I have cancer? And be open. Say, do I have cancer? Do you think I have cancer? Do you think I have multiple sclerosis? Do you think I have a collagen disease? Do you think I have an infection going on in my body? Be open. Please ask questions. We doctors, we can't read your mind. So when we look at your history, your symptoms, and we look at the laboratory studies and we examine you, we are in our mind. I can tell you what goes in our mind because I am one of those. I'm a doctor. In my mind, if I'm looking for symptoms and I am looking for patterns that point to a diagnosis like this. Sometimes I wish I could find a cancer because that would be simple. Yes, you have cancer. I'll send you to an oncologist and then they will treat you. I want to find something like that. We doctors want to find a neurological disease. That's why we order those tests. We want to examine you and then we examine. And we have been trained how to find those things. That's what we doctors do best. We are trained to find those diagnoses. Is this a collagen disease? Is this Lyme's disease? Is this Ehlers-Danlos disease? Is this, what is it? But when we are talking to you and we are examining you, I'm not telling you all of the things that I'm thinking. I'm not. I have a Rolodex of diseases in my brain, and I'm no, but I'm not telling you all of the no's. At the end, I tell you, I didn't find anything that could explain this pain. And then you are unsatisfied, and then you are, unhappy, frustrated. Oh, she spent an hour with me and she doesn't know what I have. Well, because I already excluded. No. So, but in your case, you don't know what's going on inside of our mind because we are always trying. We physicians are trained to do. This is what we do best. Find the diagnosis, remove the thing, and your problem is gone. But with chronic pain, there are different things. We're going to talk about those things, right? That don't fit into that box because the problem is somewhere else. Okay, I'll tell you what it is, okay? So then, once we arrive with the diagnosis, so then you can ask a question. I want you to be frank with your doctors. Ask them, doctor, do you think I have this genetic disorder? Do you think I have a cancer? So And then they will tell you, well, based on your questions, based on your exam, based on the laboratory studies, I don't think so. Okay, so that's the first thing. So make sure that you ask your doctor what were they thinking. That's the number one, because we also don't want to miss a serious diagnosis, right? It could be, so that's for the first reason why you would be trapped in this pain. Second reason why some people are trapped in this pain roundabout. Let me get the pain roundabout again. That's day number 5. This is the pain roundabout. Like the person is driving the car in this roundabout and the car is not getting out. The second reason why they are in this roundabout might be because they don't have access to therapies. Maybe the person doesn't have insurance. Maybe they don't even have the means to go to a doctor to get a diagnosis. Maybe they don't have available treatments where they are that could be able to treat them. That's a possibility. And maybe that's why the pain is not getting better, it's getting worse, because it's not affordable. They can't buy, they can't purchase, they don't have access to those things. So that's really sad. And in this case, they can find some online resources to find things that they could do, like a physiotherapy online, or try to get a counselor online. Of course, it's going to be difficult to do surgery online, but even I know some people need surgery and they can't access. So that would be the second reason why the pain is not going away. But again, it happens to some people, but not with the majority. Like the majority of people who come to the pain clinic and they are in this roundabout, that's not the reason, at least here in Canada. Okay. The third reason why a person may be inside of that roundabout and not getting better, it might be because they are using therapies that work for nociceptive or neuropathic pain, but in fact, their pain is nociplastic. If you watch my channel and if you watch other videos that I have on my channel, you probably have heard me talking about the 3 types of pain. And the treatments are very different. So nociceptive pain is when in the analogy of that fire alarm, the alarm of the house is if there is a fire in the kitchen, if there is something broken. Like if you have a gout attack. Gout is a very inflamed joint. It's a rheumatological thing, and you can see the knee or the toes of the foot goes really big and inflamed and red. That's an example of nociceptive pain. It's an inflammation. You need to take anti-inflammatories and then reduce that inflammation, and then that pain will go away. So that is equivalent if there's a fire in the kitchen and you need to call the fire department. They come, they put up the fire, and the alarm stops. That's the first type of mechanism of pain. The second mechanism of pain is neuropathic pain, when there are wires, the nerves are damaged. So if a nerve is damaged here, it's called carpal tunnel syndrome, and then we will see all the muscles innervated by the median nerve here will be atrophy, will be weakness, and the person will not have sensation in this part of the hand here that is innervated by the median nerve. So that's a very localized nerve problem. And every time that a nerve is damaged, diseased, we see motor problems, the muscles lose power, and the sensations get strange in the territory of the nerve. This would be equivalent of the alarm of the house going off because there is a short circuit. So you turn off the switch of the lights in your kitchen and the alarm of the house goes off. You're not going to call the fire department, you call the electrician to fix this short circuit, right? So the treatments for nerve pain is different from treatments of inflammation, a broken bone, a fracture. Those are nociceptive pain. The second one, the nerve, is neuropathic pain. Now there is a third mechanism. It's called nociplastic pain. Nociplastic pain, there is no fire in the kitchen, there's no inflammation, there's nothing broken in the body, everything is functioning perfect, there's no nerve damage, there's no nerve being pinched, there's no nerve being lesioned. All the nerves, all the joints, all the muscles, they're all perfect, but it's a malfunction of the pain system. In the alarm system of the house analogy, this would be equivalent to the alarm itself is malfunctioning. So you don't call the fire department, you don't call the electrician, you call the alarm company to come and fix the alarm. So imagine now a person has nociplastic pain. Nociplastic pain is very common. Okay, it's not rare. It's one of the most common types of mechanisms of pain that we find in the pain clinic is nociplastic pain. I have a video about that. I'll leave you here in the, I'll put the link to the video in the description here in the comments, okay? Nociplastic pain is very common. But if you keep treating that pain with things that work for nociceptive or things that work for neuropathic pain, guess what? The nociplastic pain will not go away. And you will be in this roundabout forever and ever. Again, you're using the wrong exit. You're trying to get out from this roundabout using the wrong exit. You need to find the right exit. You see how a lot of people, many of my patients who are trapped by pain is because of this. They're trying to use interventions that work for nociceptive neuropathic pain to treat a nociplastic pain, and I say it's not going to work. Okay, so that's the third reason why you may be trapped in this pain trap. The first one is your doctor is really missing a cancer or multiple sclerosis or neurological infection or genetic disorder, so ask your doctor. The second reason is you really don't have access to a lot of treatments and you need to have access and you are not. So you can't afford or it's not available to you. So that's a problem of the system that is not arranged around you to provide you with what you need. The third one is maybe you have nociplastic pain and you're using therapies that are good for nociceptive and neuropathic. The fourth reason that you might be stuck, this is also very common, is that what's going on inside of our feelings or emotions or thoughts and then how we are behaving. Because if we start telling stories to ourselves, I'm stuck, there's nothing that works for me, I am a failure, I'm failing my family, I'm failing my doctors, I'm disappointing everybody, and blaming yourself and trying to think differently, but always pessimistic thoughts is what gravitates in your mind. So you tend to gravitate towards sadness, thoughts of frustration, anxiety. If that is what is feeding your brain, if this is what you are thinking and this is you're ruminating on those thoughts, rumination and amplifying the threats, giving a lot of value to this pain, because pain is a threat. But maybe especially if you have nociplastic pain, it's not going to kill you. Nociplastic pain will not going to kill you. But if you think it's going to kill you, you make it a problem that is this tiny, a very big problem. Think about people who have fears of spiders, or people who have germ phobias. You know, people who have obsessive compulsive diseases, and they kind of they have phobias of germs in their hands and they keep washing the hands 30 times a day. What's happening in their mind is germs are real. Okay? Nobody's going to say that germs are invented in your mind. Germs are real, but the threat of those germs in your hands are minor. Like, it's not because you have a few germs in your hand that it's going to contaminate you and kill you. If you think rationally, you say, yes, that's truth. But then your emotions and your thoughts and your feelings tell you the opposite. And the person who has OCD, they can't not to think about not washing their hands. So they have to wash their hands many times a day. So what they're doing is they're amplifying the threat of those germs. Doesn't mean that they are amplifying their anxiety. That's not what I'm saying. They're amplifying what those germs mean. So this is what some people do. They amplify the threat of that pain. especially if you have nociplastic pain, the threat of nociplastic pain is minor, but in their head, it's huge. So they ruminate and they become helpless. This is what we call catastrophization, okay? So if a person has this tendency of catastrophization, we need to think rationally, and we can work with them to change those thoughts. So those are the 4 things that I can think why a person would be stuck in the trap of pain, okay? So now let's talk to the good thing, how to get unstuck, right? Because you're here because if you're here, it's probably because you know someone who is stuck in that roundabout, stuck in the trap of pain, and how can you help that person to get unstuck? So the first step is talk to the doctor about the diagnosis and ask clearly, Doctor so-and-so, do you think I have something that is very serious, that I should be worried? Do you think I have nociplastic pain? And if your doctor doesn't know what is nociplastic pain, because I understand some doctors never heard about that, it's a new term that was coined in 2018. So it's almost 7 years. People should know by now. But it's not a new concept. Nociplastic pain always existed. Since humans existed, nociplastic pain existed. It's just the term that is new. Okay, so before it was considered non-specific pain because we did not know what caused. But now what changed from non-specific to nociplastic pain is because science advanced and now we know what's causing the problem. So instead of saying a non-specific pain that we don't know what's causing it, we call nociplastic because we know they are caused by neuroplasticity changes in the pain system. It's the alarm system, it's the pain system that is malfunctioning. And when I say we, all the scientists in the world, we already know what are the problems. So we know what it is. Why should we call non-specific? Let's give a name, and the name is nociplastic. So ask your doctor, Doctor, is my pain nociplastic? If the doctor doesn't know, tell them to watch my course. I have an online course on my website only for healthcare professionals because I talk about the science and I talk about all of the medical terms in that course. And they can go onto my website. I'll put a link here in the chat so then you can tell your doctor to go and learn more about nociplastic pain. But ask them, ask your doctor, what is my diagnosis? What kind of pain are you treating? Okay. The second thing that you can do is if you think that you are in that thought process, that you are amplifying the threat of the pain, that you are ruminating around sadness, feelings of guilt and depression and anxiety, I really advise you to seek a professional counseling or psychology. They are amazing. They will help you to analyze your own thoughts. Don't think that they will come and analyze you and tell what's wrong with you. A good psychologist, a good counselor, they will come and they will help you analyze your thoughts, and you will see what's going on in your thoughts process, your memories, your emotions, your traumas. So seek someone that can counsel you and psychologist. Another thing that you can do, so you can acknowledge those feelings, acknowledge what's going on in your life. Stop and think without judging yourself. Just say, this is part of being human, and I'm not the only one. There are many people like you. You can even join some peer-led groups, people who had or have the same problems that you have. So then you see you are not alone. You're not a zebra that is very rare to find. It's very, very common what you are going through, okay? And then try to reprocess your thoughts, especially if you have been given a diagnosis of nociplastic pain. It might be really important that you want to reprocess what you're thinking. Again, a counselor that has been trained on nociplastic pain, or another name for this is neuroplastic pain, they may help you to reprocess the meaning of the pain, to lose the fear of the pain. Because a lot of I used to say the fuel of nociplastic pain is fear. The more fear you develop of that pain, more fuel you are giving to that pain. And that becomes a cycle. Maybe you're trapped, or maybe someone that you know is trapped in that roundabout because they keep fueling that pain with fear, okay? Another thing that may be helpful is self-compassion, self-love. I have a video about that, and I'm going to put a link here. Self-compassion, self-love does not mean that you're going to go to a spa and indulge yourself with massage and aromas and perfumes and creams. This is nice, but this is more indulgence. Self-compassion means setting boundaries for other people. Do not invade your space. It is doing what is priority for you before you can help someone. This doesn't mean that you're going to be egotistic and I'm going to think about myself only. No, you need to be well to take care of your children. You need to be well to take care of your husband, your wife, to work. Remember, the oxygen mask in the airplane, they say put on yourself first, right? Don't, before you try to help anyone with their oxygen mask, put on yourself first. This is really important. This is self-compassion. I'll put a link here to one of my videos. Then there is a type of therapy. It's called acceptance and commitment therapy. I also have a video about that, which says stop fighting this monster of pain. The pain became a monster in your life, and you are probably 100% of your time trying to fight this monster, and you are spending all of your energy trying to fight this monster. There's a therapy called acceptance and commitment therapy that helps you relax, stop fighting this monster, just accept that the pain is there, and then don't judge, just analyze and start focusing on the things that are important to you. Focus on your life, your goals. Okay? So those are the things, my best advice for people who are trapped in this roundabout. I would love to hear your thoughts. So if you can type in the comments, if you know someone with this kind of problem, here, I'm going to put in the comment section here, the chat. Oops, I put something, I didn't copy correctly here. Let me see. I wanted to put here the video. I want to put a link here to the video number 79. This is a video that explains the difference between nociceptive, neuropathic, and nociplastic pain. The other link that I'm putting here in the chat, let me see if I can copy this correctly here, is the video about self-compassion. And the other one that I want you to know, maybe you can recommend to your colleagues, is the acceptance and commitment therapy. If you have anyone that needs to watch one of those videos, this is where you can find on my channel. So I put the links there for you. So this is what I wanted to share with you today. If you know someone who needs this, please tell them to watch those videos and do those things that have been helping so many people. And I see here Rosangela saying she's doing PRT, very good. Yes, pain reprocessing therapy is amazing. Oh, I also have a video. I interviewed Vanessa on my channel. Let me put the video with Vanessa Blackstone that she explains what is pain reprocessing therapy. Where is the video with Vanessa? Here it is. It's video number 207. That's the video with Vanessa that she explains what is pain reprocessing therapy. It's really nice. I mentioned to you here today, right? Okay, here it is. Okay, great. So thank you everybody for watching today, and I hope that I'll be here again Wednesday next week, 11 o'clock a.m. If you have suggestions for videos or topics that you want me to talk on these live sessions, you can type here in the chat. or leave this in the comment section. Thank you again for being here with me today. So I was not alone. Tell your friends about this channel. And I have lots of videos of exercises, diet, nutrition, mental health, diagnosis of pain for different kind of problems. Okay? Thank you. Bye.